we have come to the point where we, not only us in this program, but many others doing trauma therapy, come to the point where we understand that trauma is so prevalent that for almost any condition that requires professional help by a person, almost any condition might be a result of trauma. It shows trauma has the effects that show the very symptoms of most all of the diagnoses that a psychiatrist deals with. So the people coming with these medications have usually been diagnosed with schizophrenia or with bipolar disorder or with major depression. And most of the time, these diagnoses, those symptoms that gave rise to those diagnoses can be understood as post-traumatic consequences. And you can watch those symptoms disappear as you do your work. In my experience, those people that I had been working with the diagnosis of a panic disorder, in my experience now, the panic disorder patients I see now have all been post-traumatic. And the panic states themselves are flashbacks that these people have. And that condition resolves completely once the trauma has been processed. And I would say with in my practice too, that anxiety disorder has, the ones we have seen now since we've been offering this trauma therapy, that disorder responds to treatment of the multiple traumas that these people usually have had in childhood. I would also say that there's a lot of conditions that we all see as physicians and therapists that come by all kinds of names. Some of them come by the name of obesity, some by the name of addiction, some of them by the name of impulse disorders. Those are, in my experience, the ones that I see now have been trauma-based, and they recover from those conditions when the trauma is processed. I didn't know that during my long career, and I responded to those patients with medication, and I did my best to help them deal with what they were having, but I was helping them deal with the symptoms. I was not helping them deal with the cause during those early years of my career.